Hi, guys, and welcome to another podcast from the House of Health channel. Today, I have Bali with me, and we'll be talking about a very pressing topic, which is a fatty liver disease, or as the new name, MASLD. We'll be talking all about liver disease and the role of diet. Now, we know that fatty liver disease is a silent disease. Many patients with fatty liver have no symptoms until significant liver damage occurs. 70% of people may have type 2 diabetes, and the condition have a bi-directional relationship. It's the most prevalent reason of liver disease in the world. Obesity is a major risk factor. 10 to 20% of NAFLD patients can have a normal BMI, which we call as lean MASLD. Now, what's most alarming is that fatty liver disease can be present in children and is seen more so in certain ethnic minorities. We'll be talking all about this, the role of diet, how fatty liver develops. And here with me, I have some liver specimens. So this is a healthy looking liver, nice and pink, spongy, does all the functions. But what happens when fat accumulates over time? Bali will tell us a bit more about that in a second, but your liver starts accumulating fat, starts getting fatty in real world. So yes, Bali, do you want to tell the viewers about yourself? And then we'll kick off the podcast with today's topic.
Yeah, bro. Thanks for that, Nadir. Hi, everyone. My name is Bali Parek. I am a dietitian with background and specialist interest in working with those who have liver disease and who have MASLD, alcohol-related liver disease, and even autoimmune conditions. My background is working with those who were needing surgery and transplant, and now I've kind of changed a little bit and trying to work on the side of more prevention and how do we stop people from getting to the point where they need that big surgery. And actually, you're right in saying that there's been a fourfold increase in the last 20 years in liver disease, and predominantly a lot of that has come from alcohol related and MASLD as well. And it's frustrating because as a dietitian, sometimes we're underrepresented, and we know that diet is a prevention and a treatment for this condition. And you've perfectly highlighted there how it's caused by the infiltration of fatty tissue and cells within the liver. So hopefully today we can talk a little bit about how we can use nutrition to prevent MASLD, and actually we can use nutrition and different nutrition to treat it and help improve symptoms, improve outcomes, and actually make sure people who have MASLD have a good quality of life and even reverse as much of the condition as we can. Because I think that's the key message, is that people who are living with it, they don't need to live with it and suffer in silence. It's just about getting the right support and the right guidance from a holistic medical team.
Let's start with something.
So, bro, thanks for having me.
No, pleasure, Bali. Obviously, we work together, and I understand you're an absolute expert when it comes to diet and liver disease. And me as a liver physician, I have to say, I undermine the concept of nutrition and diet. We don't really consider it as important. We're just designed to think about medications or investigations or treatments, such as liver transplant or, other things. But exercise and nutrition and diet, I've certainly educated myself over the last 5 or 6 years, understanding the importance and realizing that a lot of changes, if they're made correctly and timely, can reverse some of this liver damage. So let's start with a very simple, basic question. Now, people ask, why do I get fatty liver? It's a very, very common condition. If I see liver function tests generally referred to me and they're abnormal, I think 80% of the time it turns out to be fatty liver. So it's an extremely common condition. But why do people develop that? What is the underlying mechanism? Is it just being fat that causes fatty liver?
Yeah, I think that's what we used to think, and that's why the name came, because of that stigma, is that we used to predominantly see it in those who were living with obesity, so having being very overweight, and a lot of that was central. And people who might have had high cholesterol, high blood pressure, diabetes, these are the type of people that we would tend to see develop MASLD. But we know now that it's very complex, and what we think is there's a dysregulation in how the liver can store and metabolize the energy that it gets. And over time, as there's significant damage from intake of substances, from intake of high fructose, high sugars, very high fatty foods, the liver struggles, in some people, the liver struggles to metabolize and use these energies very quickly and efficiently. And over time, this can develop to resistance in how the liver essentially gets rid of this. And it starts to store it as extra energy within the cells within the liver. And what we call this is the steatosis of the cells in the liver, where the excess energy, the triglycerides, start to infiltrate some of the cells, the healthy cells in the liver, which reduces how efficiently they work. It makes the liver more stiff and changes the overall appearance of the liver. Now, what we know with liver disease is that it's compounding a lot of the time. Perfect, yeah. So what happens is it's not just this is, you've had a lot of a very high sugar diet and you've not exercised and, you smoke and you consume a lot of alcohol one day. It's doing this 1 week, 2 weeks, 3 weeks, and that compounding effect of putting that stress on the liver over time makes a really big difference. We also know now that actually a lack of physical activity affects how the liver can use the fuel that we give it. So the type of carbohydrates, fats, proteins that we give the body, the more we exercise, the more efficient the body becomes at using these fuels. So we know that people who don't do a lot of general activity, whether that be cardiovascular or strength, are also more at risk of developing this fatty liver, this steatotic inflammation. And the third thing we know now that is how sleep impacts it so much. Those who are shift workers, those who don't get very well good night's sleep, 6 to 8 hours a day, we know that your liver runs off its own circadian clock. And actually, when we dysregulate and disrupt this on a regular basis, it changes the way, again, it metabolizes and stores the energy, which again leads to that steatosis and infiltration of the fat into the cells. So it's multifactorial. It's lots of things, but lots of small things adding up very fast over time. And I think that's why we've seen such a big development and big rising over the last few years, because of the environment that we live in, the high stress, the high calorific, high energy, high sugar environment where things are very easily accessible and it's very easy to overconsume. And for some of us, that makes it much easier for us to develop this condition.
The things that you touched upon, which may be contributing towards MASLD, I mean, one of the things that we now know, and there's an increasing amount of research, is your gut microbiome. We know that dysbiosis in your gut microbiome can also significantly impact. Now, coming down to the reasons why people would develop MASLD, I think it's important to touch upon the high fructose consumption and the impact of fructose that directly contributes to not only fat accumulation in the liver through de novo lipogenesis, through different metabolic pathways. I think it's very important to tell people about, when we see a sugar-free drink and it has fructose in it, it is equally, if not, worse than consuming sugar. So how does fructose impact that? And do you think this is the problem, like you mentioned about, the calorific environment we're living in, the excessive sugar environment we live in these days?
Yeah, great question. So fructose is another type of sugar that the body metabolizes, similar to glucose, galactose, lactose. These are all different forms of starch and different forms of sugar. Now, fructose is primarily metabolized by the liver. It's different to glucose, which can be easily absorbed in the oral mucosa and in other areas of the intestinal tract. Fructose is predominantly metabolized in the liver. And actually, the amount the liver can do is limited. So we know from sports supplements that actually an optimal dose is having a 2-to-1 glucose to fructose ratio. For instance, having 2 molecules of glucose and 1 molecule of fructose can help us absorb things at a fast rate. Now, this is exactly what they do in these high sugar, high fat foods, where they have a lot of glucose and they pair it with fructose, so we get the maximum amount of sugar the body can metabolize at that time. Over a compounding time, the liver finds it hard to metabolize all of the fructose very fast. And it increases de novo lipogenesis and increases that fatty infiltration of the liver as well in terms of steatosis. And fructose often is misidentified that it comes from fruit. But when we consume fructose from fruit in the form with water and fiber, how it's absorbed and digested is very different to when we have fructose from a sugary drink, a Pop-Tart, a chocolate bar, sweets, these things have a very high dose of fructose, and over time they massively impact how the liver can store and metabolize these molecules. So yeah, 100% the first line of advice is actually, if that's something that's high in somebody's diet, even a reduction in that without changing anything else can make a big difference into liver stiffness and liver fibrosis and the fattiness of the liver.
Interestingly, fatty liver disease, when it's progressing, we know that it can be silent. Now, what silent means is that people will not have any signs and
Mm.
symptoms. Most cases are discovered incidentally. So they will get their blood tests. They will find that one of their liver enzymes is slightly elevated. That leads to an ultrasound. Ultrasound shows a
Yeah.
bit of fatty infiltration. One of the things that we do is a FibroScan, which is quantifying the fat, fibrosis, and the damage in the liver. And we know that the damage is often, quite a slow burning disease. Damage occurs over, like you said, months and years, because your habits are there, they're just building up, and maybe compounding factors of everything just results in progressive damage. Now, my question is, as a dietitian, is fatty liver disease reversible? If so, what is your advice on how can people reduce the fatty liver? This is the most common question they ask us. And we know that there isn't really a
Yeah,
medication that I can give them. Yes, there are GLP-1 analogs, and we'll talk about that in a bit, but diet and exercise is key. So what is
yeah,
your advice for such patients?
yeah. Perfect. So just to highlight what you said there is, anyone that's got diagnosed with fatty liver disease at any stage, the first thing their doctor or GP or consultant should do is refer them to a dietitian, because everybody should be given the chance to help to improve their diet, to be on the right path, to give them the best chance of any potential treatment that they might need, whether they have a very mild fatty liver or whether it's almost close to being cirrhotic. Everyone deserves a chance to get the right nutritional advice. Now, I would say I have 5 big tips for MASLD or fatty liver disease. Number one, we need to increase our fiber intake, because you highlighted earlier about that gut dysbiosis and the good and bad bacteria within the gut. We know that having a high fiber diet can support restoring that barrier and restoring that good microbiome. So increasing your vegetable intake, having a rainbow of colors throughout the week is really, really important. Number two is increasing your protein intake. To actually remove and repair some of those cells in the liver, your body needs additional protein. And when we have liver disease, what we tend to find is 2 things, is that you have a reduced protein pool, so a reduced amino acid availability. And often those who have fatty liver disease are consuming insufficient amounts of protein. So you've got less supply and less store, which is a combination for disaster essentially. So actually increasing lean protein intake can make a massive difference in supporting that liver regeneration and that liver health. The third thing is reducing down sugars and fast-acting carbohydrates. So we don't necessarily recommend a full ketogenic diet, but we might recommend a moderate to low carbohydrate diet where you have starchy carbohydrates, oats, whole grain rice, whole grain pasta, these kind of things at your main meals, and we're reducing any white rice, white pastas, any biscuits, any sugars, any chocolate bars, fizzy drinks. We're doing our best to work with you to reduce that down. The fourth thing I always recommend is actually, if those are still drinking alcohol, sometimes we find that people who inadvertently have fatty liver disease also drink alcohol. We know that's damaging to the liver as well. So actually, if we can, for a period of time, we can maintain abstinence, we can improve outcomes and reverse some of that steatosis very, very quickly, even within 6 to 12 weeks. And then the fifth thing, and I think this is now even more important with recent research, is starting to exercise. And that does not mean you have to become a bodybuilder and you have to be going to the gym to doing squats and bench presses. I mean, if you're not doing 5,000 steps a day, let's go with that as a goal. If you're only doing 20 minutes of walking, let's go for 25 minutes. Let's go for 30, because you're using that stored energy and you're allowing your liver to learn how to use some of that energy that you're consuming. Now, if you do all 5 of these things in small amounts, give it 4, 5, 6 weeks, those compounding effects, you'll see a big return in your investment. And I think that's the key 5 things to try and implement in terms of a diet regimen for somebody that's been newly diagnosed with MASLD refer them to a dietitian, give them the best chance to reverse that, to improve their symptoms, and then work with the rest of the team if there's other things that we need to work on. But that will give them the best chance to start
Those are
with.
amazing tips, Bali. Honestly, anyone with fatty liver disease should listen to the 5 tips you've given. And again, these are small increment steps that you need to bring in. And key is consistency. I guess we have seen, with your work, with the team that we used to work in, that you would, people who were very, very deconditioned, physically, from a functionality point of view, were able to make great steps with just consistency and making those small changes. Now, let's discuss
Yeah.
a very interesting topic. Everyone's talking about them, are the GLP-1 medications. So let's talk about what your take on that is. We obviously at House of Health run a weight loss clinic whereby, like yourself, we include a dietitian, a physiotherapist, we do regular check-ins. What's your take on GLP-1? Take on that with obesity and obviously keeping MASLD in mind?
Yeah, I think GLP-1s are one of the best inventions probably in the last 10 years, I think, from an obesity perspective. Firstly, it's important, like with MASLD, is that there's no stigma attached to living with obesity. It's a chronic relapsing condition that's multifactorial, and it's not the individual's fault. So actually having a medication that can support their biochemistry and their physiology to achieving that weight loss, to make them, improve their self-esteem to begin with, but then actually make their risk profile for other diseases even better, I think that's a game changer. I think we know in late stage MASLD, once they've developed diabetes is a different beast in liver disease. It's very, very difficult to manage. And actually running a specialist clinic with a diabetologist and an endocrinologist, a MASLD consultant and a dietitian with the use of GLP-1 in that area is very beneficial because it's very hard to manage diabetes control without additional support in liver disease. So in that aspect, they're amazing. I think there's still a lot of research, and we'll have some long studies coming out in terms of the long-term pros and cons of them. They've not been around long enough for us to know how amazing they are, and they will obviously only get better. My tips when I've worked with people is, one is to maintain exercising. We know that you're going to lose weight. You're likely to lose, a lot of it is likely to be adipose, so fat tissue. You may lose some muscle mass. Some people lose muscle, some people don't. The evidence is very 50-50, but you're likely to, because when we lose weight, a lot of the time we lose a bit of everything. The best way to maintain muscle mass is resistance training. So if you're somebody on a GLP-1, I would be trying to incorporate 2 to 3 sessions of resistance training, working with a strength and conditioning coach or a physiotherapist to maintain that muscle. That is the best way. A close second is going to be maintaining a sufficient amount of protein intake. Now, the recommendations might be between 1.4 to 2 gram per kilogram of body weight. So if you're 60 kilogram of weight, or that's your target lean weight, that might be 90 to 120 grams of protein a day, for an example. So those would be my top 2 tips for somebody who is living with obesity or living with MASLD and has started a GLP-1 to help reduce some of that burden, reduce some of that weight, is start resistance exercising, even if it's a small amount. Build that habit while the drugs are helping you, build that habit in. And 2, really focus on seeing if you can get good dietary sources of protein. A third take might be to work on your diet pattern. So using that time to get healthier habits, education on different food groups, education on how to maintain and sustain maybe for a period after GLP-1s. I think we're not sure enough how quickly the weight regain happens when you stop. And even if healthy diet minimizes that, I think there's not enough research to show how effective that is yet, to know that you may have to follow a certain regime and diet after long term.
My take on that is, when it comes to, whether it's exercising, what happens if you stop exercising? You'll gain the weight back. What happens when you stop eating healthy?
Yeah, true.
I think we kind of focus a lot on the negatives of these medications, Now, I see people who've never been to the
Yeah.
gym. They can't walk because they're so obese. Their knees cannot take the pressure of walking or exercising. For these kind of patients, it's very easy for us to say at times, why doesn't he join the gym? Or why can't he go on that diet? They've just never done that before. They don't know what to do in the gym. Imagine,
Yeah.
just thinking about Birmingham, for example. We see a lot of Asian, females. Imagine an Asian female who's never really joined the gym ever in her life, and she's coming to you at the age of 45. She can never actually go in the gym and make a huge
Yeah.
progress. This will kickstart them. This will give them the motivation. This will give them that kind of self-confidence to look better, to go into the gym. So I think there's definitely a need. Within with anything, there is risk of abuse, and there are people who are using it, buying it off the internet.
Yeah.
So no, definitely that's great. Now, one of the things that we often find, Bali, with GLP-1 medications is that the weight loss is quite rapid, and often we find people getting almost like you see these what we call as Ozempic faces. You see their skin sagging. Is
Mm.
that because of rapid muscle loss alongside fat? And how would you recommend counteracting something like that?
Yeah, good question. That is due to rapid weight loss, but actually the evidence suggests actually the more you lose more quickly sometimes, if you're very or very obese, that the less you'll put on afterwards. So it's actually a very positive thing in that aspect. It's very individual. That's a hard question to answer because I think it's really individual and what are they doing at the moment. If it's somebody like you said that's never exercised before and alongside their GLP-1 is actually not eating anything, it might be that we're incorporating a diet regime alongside it to help them and incorporating that protein intake and their exercise. But actually, some people, they may just have a lot of stored fat underneath their skin and they might store it on their face. And actually, because they've lost that and it's been there for so long, that may just be a unwanted side
Yeah.
effect of it. So it's I would hate to give a very direct answer, but it's very difficult to say because I've seen people that don't have it and they just lose the weight where we need them to lose it. It's such an everyone that has the drug has such an individual response. It's so interesting when you work with people who are taking these GLP-1s and taking them for a period of time. They have such an individual response and everyone's physiology responds to it so differently. And the way they lose muscle and the amount they lose and where they lose it from and where they lose the fat as well is so interesting. And how it impacts the other aspects of their life too. If they've got any other addictions or any other habits, we know that it works on that same neural pathway.
Absolutely.
So I don't have a straight answer for you there. I'm not too sure because I think it's very individual. But I think if somebody's losing their weight and a lot of muscle very fast, I would do the first two in terms of increasing their exercise resistance training and increasing their protein intake. Now we could do boxers techniques, and start training their neck
Yeah.
muscles and training their jaws. I don't think I
Yeah.
would take it to that level with
No, there's
the
definitely the
first
role of
appointment.
resistance trainings, like you said, training your muscles, because, at the end of the day, the saggy, skin appearance or the body appearance can be counteracted by, building a bit of muscle.
Yeah,
Fantastic discussion today, Bali. I just want to tell the viewers that we're planning to start our one-stop shop fatty liver clinic. Bali will be joining us at the House of Health, and we're very glad that he's joining our team. Now, Bali, if I know you work with a lot of athletes. You work with a lot of, performance athletes, work with fatty liver, work with all sorts of people. If someone is trying to get some dietary advice from you, I know you are traveling but you're still continuing to work. How can they get in touch with you? What would your rule be if someone has fatty
yeah,
liver? If I was to have fatty liver, I was to ask you, how long do they need to work with you? Do you give them a plan to work with? And how does your consultation work?
yeah, yeah. Amazing, good question. So if somebody wants to get in touch with me, obviously we'll give the link for this description below, and then they can just follow the link and go through my website or drop me an email, or send me a message. My number's on there as well for people to send me a message if they wanted some support. Now, in terms of a consultation, it's completely individualized to the person that I'm working with. So if you've come to me and you've been diagnosed with fatty liver disease, we would do a full dietary assessment in terms of your current weight, your current needs, what you're eating at the moment. And then actually, my advice would be to work with me for 6 to 12 weeks based off where we're at and the extent of the condition and really have a targeted one-to-one supportive approach where we touch base weekly. We give you that weekly coaching, give you dietary advice to follow, protein targets, meal plans, recipes. So, you really a supportive and coaching culture where actually you feel as though for 12 weeks you've got access to me. You can ask me any questions, and we really provide a personalized support for you over that period to try and make sure you get the best results. And then working with your consultant based on the medications you ran, getting repeat blood tests, getting a repeat fiber scan to make sure that actually what we're doing is working, because we're only as good as the team that we work with. So it's great to be joining yourself and having that communication and that two-way connection in terms of when we're working with people together. But yeah, if somebody wants to get in touch and they need some support, feel free to just follow the link in the description below.
Absolutely. That's great. Fantastic. So guys, stay tuned, subscribe to our channel. Me and Bali will be doing a series of episodes talking about various different liver diseases. We'll be talking about MASLD, autoimmune liver conditions, performance athletes and their liver health. So, there's a lot more to come, and I'm really excited about, jumping on another podcast and discussing all things liver and diet with Bali. Bali, thank you very much for your time. I really appreciate that.
Cheers.
And we wish you all the best for your endeavors. I know you are in Thailand. Is that correct?
Yeah, Thailand at the moment.
Fantastic. Well, we hope to see you back in the UK. And yes, guys, like, subscribe, follow at House of Health. And if you have any questions regarding fatty liver disease, particularly, please drop them in the comment section below. I'm your host, Dr. Nader Abbas, signing out. Thank you again, Bali. Thanks for your time.
Cheers. Take care.
Bye-bye.
Bye.